Yes, Emily?
Hello, I'm Emily Holzhausen. I'm Director of Policy and Public Affairs at Carers UK. We're an organisation that represents and is made up of family members and close friends who care for their relatives. So we're here today because we also provide a lot of advice and information. They tell us their experiences, and we work very closely with working families. And we also have an Employers for Carers network of good practice employers, which is about 130 employers, so quite a lot of different and range of experience.
Right. Moira?
Hello, I'm Moira Wilkinson. I'm a network manager at Carers Trust. Our organisation is made up of a network of local organisations, local carer support organisations, providing very detailed and one-to-one support for carers across the UK. And we also have some employment projects which we're working with carers to help them back into employment.
Well, with this session, we really want to emphasise that's what we're seeking your advice on, about combining caring and working. So, Ruth, might you begin? And Heidi?
Thank you. Good morning. Could you just start us off by saying in turn, please, what you feel are the main challenges faced by people who are trying to juggle their caring responsibilities with paid work?
From my point of view, the first is that when you become a carer, that's often the point at which you drop out of the workforce because it just all seems too difficult. And so what we think would really help, and parents have told us would help, would be a period of paid adjustment leave, different from the day-to-day carer leave to manage the condition that you're caring for. This would be a period of weeks to adjust to new family circumstances and then come back and talk to your employer about how you stay on. We also know that one of the real barriers to work, or both remaining in work and getting a new job, is the lack of suitable, flexible working opportunities. And so we are absolutely saying we need a jobs revolution in the UK. All jobs should be designed, thought through, and then advertised flexibly, as the Prime Minister has recently called for, because that will open up the jobs market to those who've got the skills and got the motivation but can't find the opportunity. And the final thing is the cost of childcare. If you're caring for a disabled child, is at least double in many cases the cost of caring for a child who's not disabled. What we'd like to see is the tax-free child care scheme, which government thought about and very generously have increased the allowance for a parent who's got a disabled child from £10,000 to £20,000 a year. But actually, if you can't afford £10,000, you can't afford £20,000 either. It would be a much more effective thing to double the tax-free contribution from 20% to 40%.
Very good. Emily?
So we've done a lot of research with families and with employers over the years, and there are several real issues that people have juggling work and care. The first is that people don't identify themselves as carers and find it very difficult to find their pathway through information and advice. And as such, they don't always get the right support that enables them to juggle work and care. And I'm sure you know, just trying to knit up the health service, the benefits system, social care services, which has been under extreme pressure, is extremely difficult. People are also concerned that they won't have a supportive employer, and we have mixed experiences of that. We have excellent practice of supportive employers, and we can see where employers really don't understand the issue of caring. It's almost as if it's like the childcare movement was almost 20 years ago, where people are worried about raising those issues in the workplace for fear of some challenge from the employer. So there's a real difficulty with people. There's about 1 in 9 employees has a caring responsibility, and it'll be exactly the same here within the Houses of Parliament, and colleagues who have got caring responsibilities. So there's an issue in finding the right care, knowing where to look, having a supportive employer, and what those rights and entitlements are within the workplace. And again, we were very lucky to work with some very supportive employers who are really trying to look at the ageing population that we have, trying to keep people in employment. But the rights base is really quite underdeveloped. So if we were to take a parent of a disabled child, they have improved rights within the workplace. But as soon as that child is 19 and moves up through the age spectrum, they have very few. They have a right to request flexible working and a right to take emergency time off. But beyond that, what we're asking for is a right to paid care leave of between 5 and 10 days. And the work that we've done internationally and looked across the world, we're lagging behind other countries on that front. And that is where other countries, especially Japan, with a very much more advanced ageing population, is really looking to, has looked to keep women in particular in the workplace. But of course it applies just equally to men who've got caring responsibilities. So those are the things that are important.
Yeah, absolutely endorse everything that these two have said, and I think the experiences that the very clear experience of the carers that we've been working with closely in London, for example, in the last year on our Working for Carers programme, lack of good social care, lack of availability, the cost of that as well is one of the huge barriers. People are really fearful of being able to get that sort of care when they need it. The flexibility, I think, is absolutely the key issue, that people need flexible working. Lots of our carers are actually looking for self-employment, mainly because they feel that's the only way that they'll be able to work flexibly enough. And that's great, and we're able to support them and encouraging them. But I think, flexibility for all, if flexibility was written into all job contracts, it wouldn't be something special for carers. It would just be something which is normal. And we're moving towards that with people working from home, with the technology and so on. But I think that issue really needs to be raised. And I think the other issue that's really come to light with the one-to-one work we've been doing with carers is the lack of confidence, because a lot of people have been out of the workplace for maybe 10, 20 years. And, some have been out for less time than that, but feel that they've lost skills, they've lost confidence. The workplace has changed. I've seen it changing enormously over those years. And, it's quite difficult to have the confidence to move back into that, and actually having the one-to-one support that we've been able to give, just for short periods most of the time, just the understanding of their needs, and also helping people to recognise the skills that they've built up, because they've built up skills whilst they've been at home caring, but they're not able to recognise those. So I think actually being able to give people that little boost and that bit of support has helped a lot of the carers to move back into employment.
Ruth?
Thank you. Sarah, you touched on the cost of childcare, but otherwise you didn't particularly talk about financial pressures. What are the sort of financial pressures that carers face, both moving in and out of employment?
Can I answer that question? There are huge penalties, of course, in giving up work to care. We find that around 2 million people have given up work to care. If you look at the pensions contributions of women in particular who have been caring, there's several percentage points lower, which has been pointed out by John Cridland in his Future Pensions Review. Families find it incredibly difficult to afford social care. We found that for those that gave up work to care in our survey, for around half, the reason was because there wasn't affordable social care available. And that continues to be a concern where we have an ageing population. The loss of income is approximately a drop of about £15,000 a year that we measured several years ago. That's just one in-year cost for a family, but of course, it depends on the family. And people face significant financial challenges. If they come onto the benefit system, then of course carers allowance is the main benefit that they can claim if they're entitled to it, and that is one of the lowest benefits of its kind, that will be £64.10, so it's lower than job seekers allowance, and for that they have to be providing at least 35 hours care a week. So there are really significant pressures on people. We need people to stay in work for as long as possible. They want to stay in work for as long as possible. And they also see it as a change and a difference from caring. Some even call it a break from caring. And it's really vital for families' resilience, financial resilience, long term, to be able to have that choice about juggling work and care.
Thank you.
Can I just ask, you talked about 10 to 15 days paid care. Where does the figure come from?
The 5 to 10 days.
5 to 10 days where you can...
We've looked around at different policies, and we've looked at what's currently within the labour market as well, within employers, and we felt that was a reasonable start. I don't think we'll go, the Japan looks at 93 days, which is very much higher. It's not too dissimilar to what public sector employees have in the US, in the United States. and it's a step on and it's a slight step up. So we thought that would be more of a manageable level, and it would be where people where it's not necessarily an emergency but is important. So it might be helping smooth discharge from hospital, it might be arranging for new care arrangements, somebody going into residential care, or helping a disabled family member move house. So there's a whole range of different circumstances where that would be useful. What employers say is that, and the evidence from carers is at the moment, if there's an absence of that very clear policy with an employer, people either take their annual leave, which makes them very, very tired, or they take sick days, neither of which is really desirable within the workplace.
Great. Quick one from Alex and then over to Heidi.
Thanks, Frank. Sorry to ask you sort of detailed questions about the state of system in Japan, but obviously 93 days puts it in an entirely different universe to what we have here. But it sounds very interesting. Very quickly, are there any other aspects of the Japanese system that you would recommend to us? And secondly, do you know how the Japanese system is funded?
I don't know how the Japanese system is funded. I'll have to come back with a note to the committee to say how that's funded. There are a range of, across the world, there are a range of different ways that those policies are funded. Some are employer funded, some are part state funded in terms of what people receive as how that paid care leave is paid, if you like. So if you don't mind, I'll come back with that. Japan is actually reviewing their work-life balance policies at the moment to increase them in terms of the range and the breadth, simply because of the ageing population structure and the need to have more women in work and the familial responsibilities they have around care.
Very good, thanks. Heidi?
Thank you. So employers, I'm trying to imagine scenarios. So I guess there can be workers who suddenly find themselves becoming carers and drop out of work as a consequence, or those that have been caring for some time and perhaps their elderly relative passes away and they're ready to come back to work. Can you talk me through how much employers get those two category of people, and what are they doing or what can they do to help that? Because it strikes me that particularly with disability and ageing population, this is going to get bigger. And whatever you think about Brexit, access to workforce might become more difficult. So I'm interested, and we'll come on to the DWP angle and what they can do to support later, but what do employers get it first of all? This is possibly a ticking time bomb for them workforce-wise. I'm thinking all these skills of resilience and adaptability that are in those carers that haven't been in work for a while. They might need to learn new skills, but they've been doing really difficult jobs. So do employers get it, both keeping people in work and also bringing them back in again? Should we start at Moira maybe and work the other way?
I would say that there are employers who get it, but I would say that they're probably not the majority. And obviously there are lots of employers who are becoming quite interested, I think, now in finding out how they can support carers within the workplace. So people are starting, often the larger companies that are starting to set up carers networks and so on. So
is this for existing employees to keep?
I'm thinking about for keeping existing employees, yeah. And so I think that's really important, because you're right, losing carers from your workforce is bad for everyone. It's bad for the country, it's bad for everyone, it's bad for the carers, it's bad for the company. And I think that's something that we need to work really hard to get people to understand how they can support the carers to stay in work, not to just, so many carers say, I just couldn't cope. My husband had a stroke, this happened, everything crashes in on you, and the solution is leave your job. It's not really the best solution, as you realise at a later stage. So I think it is something we need to really focus on and do a lot more work. And obviously Employers for Carers has been doing this work, and it's starting to have an impact. But frankly, I think we'd all agree there's many employers out there who just don't get it.
And is this smaller employers more typically?
I think it varies. I mean, I think if an employer has had experience of having a carer in the workplace and has actually been helped to understand what would help that person, then they get it. People don't think about caring until it comes on, until it comes and hits you in the face. Really, that's the truth for all of us. It's not something that people go around thinking, oh, I might be a carer. Well, you probably will be a carer one day, but it's not something we think about, is it? So we don't think about it till it happens.
Do any of you have, I've talked about flexibility a lot, any other ideas as to what more employers can do to keep people in work and also bring carers in?
I think actually being open within a company, that it's okay to be a carer and it's okay to talk about that, because carers very much keep it a secret, I think. They feel it's something that they'll be seen as less good. You know, they won't be considered for promotions. They won't be, you know, given the better jobs because they're seen as perhaps less reliable. So I think openness and an ability to talk about the fact that it's okay to be a carer, it's okay to talk about your caring role, and actually it's okay to make adjustments for that. Doesn't mean you do less, it just means you may work differently. Okay. So I think the flexibility and the openness are really, really important.
Anything to add, Emily?
Yes, there are a few different mechanisms, and Sarah's got a very important thing that she needs to add as well. Leadership. Quite often, if you have a senior champion within a company, and quite often we've found they're people with caring responsibilities, men and women, that makes a huge amount of difference. Mechanisms like a specific carers policy, so it's because people don't really understand that special leave might also apply, etc. Line manager training is absolutely critical. We come back time and again to understanding how to apply these different flexibilities. And finally, there are different mechanisms of carers network. British Gas has had a carers network for several years, and it's practically one of the longest running that's been awarded by working families, and has over 1,000 employees who are part of it. Very supportive network. Things like carers passports. It's a way of describing your situation and talking about informal flexibility within the workplace. So that's something that has been run out through people like BT. BT have also in the past, I know, because I was driving along hearing an advert, positively advertising flexibility and mentioning caring responsibilities for older people, and that is really, really valuable.
Step change.
Yeah.
Sarah?
I think that the first challenge for business is to understand the scale of the business risk. So if you think that 1 in 9 of your people is likely to have caring responsibilities, actually that's quite a number of people who may be about to leave. And if you also think that there is a vast pool of talented people who are looking to get in, that's another thing you should be thinking about. So I thought it'd be useful to talk about 2 specific examples of employers who are addressing the challenge of making it clear that they are carer-friendly organisations. So they're both coincidentally in Scotland. One is a small organisation, Highlands and Islands Enterprise, which is based over a scattered number of locations, and the other is West Dunbartonshire Council, obviously a big employer. So Highlands and Islands, what they've got is an HR team champion for carers, and every new recruit has a personal interview at which the HR champion explains what the organisation's carer policies are and encourages the person, if they already have care responsibilities, to join the informal carers register in the organisation. But the really important thing that that's doing is it's establishing from the get-go that this is an organisation who will positively support you if you become a carer or if you already are. And what West Dunbartonshire Council are doing is they're the first Scottish local authority who've adopted the Happy to Talk flexible working approach to recruitment, which is to analyse every job before you advertise it and make explicit within the advert and the role description what flexibility is available. And that means that they're now asking all prospective employees if they wish to work flexibly, and if so, how, so that the fit can be worked out. On top of that, they've introduced a scheme whereby, subject to the criteria of the post, obviously, but almost all jobs, they will guarantee you an interview if you're returning from a period of carers leave, if you've been out of the workforce for a time. So it's beginning to try and tackle that loss of confidence that Moira was talking about earlier. So what you've got there are 2 very different organisations who are beginning to understand the importance of retaining and attracting carers, and are also understanding that the point of recruitment is the point when you can start establishing the culture. Because what we see amongst our best practice organisations is super policies, lovely policies, many of which Emily's referred to, but there's often a big gap between policy and lived experience. And a lot of that is down to the communication of it within the organisation. You have to keep selling all your policies, all your work-life balance policies, as though they were one of your products, because otherwise people forget. And when something happens in your life, you don't go and look at the staff handbook, which is wadges thick. You just try and deal with the situation. And for carers, that often means throwing up your hands and saying, I'm off.
Heidi? Yeah.
Yeah, that's fine. I suppose the only other thing, the recruitment angle is very important. You know, I reflect on my own team, have a laptop, work from home, you've got kiddies that might get ill. It's having children in some ways, we should have a flexible workforce policy for all kinds of people. We haven't touched much on getting people in that have been out of work for a long time. I'm hearing a lot about retaining. Is there anything you can add about bringing them in?
Yes. We did some work with British Gas nearly just under about 18 years ago, funded pilot, and then later some European funded work. And much of what we found was then echoed in current work being done by Carers Trust. So returning to work, the distance from the labour market is almost accelerated because of the isolation of caring, because caring might take up so much of your time. Huge loss of confidence. So even people who were well qualified and had very good skills had that loss of confidence that needed building to get back into the labour market. The two biggest challenges of getting people back, as well as the loss of confidence, were really some of the sort of slightly tricky benefits regulations, and all the benefits have changed very significantly over that time. One is the earnings limit on carers allowance. The other is, if people are still caring, is the double bind that they're in. And again, an analogy can be made with childcare. Until you've got reliable care and you know that the person that you're caring for is safe at home and is having a positive life, you can't work. But you can't work until you have the care. Now, when we've gone and looked at, well, you could go to your local authority and ask for a carers assessment. When we've asked how long that's taken, it takes between 3 and 6 months. And there are not necessarily the guaranteed outcomes of the social care that you might need to get it back into work, even though that beautifully crafted piece of legislation also says that work's very important. So there's a mismatch between what people want to do, what people can do. I can tell you about the earnings limit on carers allowance. The earnings limit you can earn up to, from April 2018, it will have gone up from £116 to £120 a week after certain deductions. We very much welcome that increase. The problem is that it doesn't link with the national minimum wage.
We want to come on to that a bit later. So.
All right then. So,
quick one from Chris, and then we're to Andrew.
I was just going to ask, my colleague had asked about whether there's a difference between large businesses and small businesses, but what I wanted to ask you all is, are there particular problems in some sectors of the economy when it comes to employing carers? Like, for example, where shift changes, late notice shift changes are prevalent, for example, either to work additional hours or even where there's a shift cancellation.
Yeah, it's really interesting actually, because on one person's flexibility is another person's rigidity. So actually, for carers, there was a carer who worked within a shift pattern, exactly that issue. And for him, he was caring for his wife with MS. For him, it was actually a fixed shift pattern, because the care assistants would come in, hopefully on time, not always on time. He would then, and of course that affected his ability to work, but with the fixed shift pattern, he could then organise the care with his wife and for his wife. Without a shift pattern, that's an impossibility for him, and he had small children as well. So that kind of fixed shift is really important. For others, a more flexible shift pattern is ideal. But being able to negotiate that, and that with the employers that we work with people like the Met and London Underground, that's important as well. Within those types of environments, they work that through.
Right. Andrew?
Thank you. Good morning. It's been suggested in our written evidence and heard today that there's a lack of consistency across the board in terms of how employers deal with carers. I think the MS Society said it was very much down to luck, which is obviously unfortunate. Do you think the DWP could be doing more to support carers in employment? And if so, what should they be doing? And Sarah?
I would say a very simple thing to do is to really train up the work coaches, because what we know is that carers' experience of work coaches and trying to get back into work varies hugely. There is no consistency. So one work coach will be incredibly understanding of your care responsibilities and the restrictions and constraints that those create, and another will not be, and you will be quickly into the sanctions system. So proper training to encourage or to enable work coaches to really understand what caring means and to give them the confidence to use their discretion to support people case by case would really help.
Okay.
I absolutely agree with that. I think more flexibility around the types of support mechanisms that would help carers back into work. There used to be a fund which would support carers training. One of the challenges was that it wasn't hugely known about across the DWP. It doesn't exist in that form anymore. But that could be looked at. Certainly care awareness training fits very well with that. We've also developed an e-learning tool which looks at helping carers regain their confidence and look at the skills that they've attained whilst they've been caring on their pathway back to work. It's based on a model that we did years ago with City and Guilds but was no longer funded anymore. And we hope to be able to work with DWP to look at how that might be used with carers to be able to credit their skills to get back into work.
Okay.
The one final thing I would say is that there's quite a strong link between health and work and caring, and perhaps that's something that the DWP could look in the future. Look at health and work and disability in significant depth, but not health and work and caring. That would be an area for development.
Maura?
And yeah, just to add to that, I think that when the DWP, with our programmes, where DWP are working well with their local carers organisations, they can really do some very focused work with carers, and actually it raises awareness, obviously, of the staff in the DWP of the needs of carers, but it also helps to link the carers in with local support, and that can very quickly help to boost their confidence and to give them the little bit of extra support.
And
they
there are
need.
examples of that happening.
So the Working for Carers programme in London is one of the BBO ESF funded Big Lottery funded programmes, and we're working closely in most of the areas now with the DWP and actually helping carers get back into work quite quickly in some cases, because they're ready to think about it. They're coming to us because they're ready to think about it. They just haven't quite got the confidence to go out there and find the work. And I think that the understanding their needs and actually understanding their situation is what really helps them. It gives them the confidence.
You're talking more about a cultural shift.
It's a cultural shift within the DWP probably, and it's a mind shift, I suppose, in the carers, because they start with no confidence and feeling that they won't be able to work and they don't have anything to offer, and actually are able to build their confidence through having someone who understands the situation and through meeting with other carers as well and seeing how it works.
You think a cultural shift within the DWP would then translate into a cultural shift sort of across the board?
Well, I think it would help, and I think they can help with employers as well, with actually helping to raise the things that we've been talking about in terms of the flexibility and so on, because they've got the contacts. Okay. That would be a really good piece of, a really good
development
way to go forward. Yeah.
Okay. Fine.
Thank you. Can I just ask Sarah, but all of you, because the committee is concerned about how we can put a more human face on sanctions. I mean, we agree with sanctions, but it's how they might be sometimes applied. Might you give us examples of where they've been applied well? I mean, in the sense people have not been able to turn up for interviews, have not been able to progress in jobs because of their caring responsibilities, and DWP have been very understanding about that, and where that's not occurred, so that we can think about recommendations making it to the DWP. They try and get up to the best standards.
I think the best thing, we can go away and get you some examples.
Would you do that?
Yeah,
So it'd be brilliant.
Yeah.
Thank you very, very much. Thank you. Jack and Chris. Is this Chris? Not that Chris, isn't it? Number 6. Group would be very, very grateful. Thank you. Doing the water, might you begin by, like the other panel, introduce yourself and we go down the table.
It's Nicola Best. I work for I work for a charity in Northamptonshire called Northamptonshire Carers, which has been going for 26 years. I'm currently in the role of supporting working carers and also working under Building Better Opportunities, which has been referred to about helping carers get back into work. But in Northamptonshire, I was also the lead for, we were one of the 9 pilots under the Carers in Employment pilot, which was linked to Department of Health, Department of Work and Pensions and Government Inequalities Office.
Really good. Joanne?
Hi, I'm Joanne Speed. I'm the former Chief Executive of the Dove Service, which is one of the 9 pilots in the Carers and Employment scheme. And I'm currently the Finance Director of a charity called Saltbox, based in Stoke, Staffordshire. It also works with carers. And I'd also like to add I've got personal experience of caring for elderly relatives and working at the same time whilst having children. So one of the sandwich generation. Yeah.
Great. Yeah.
Hi, I'm Fiona Malpass. I'm the project manager for Carers and Paid Employment and the BBA project, so getting people back into work as well as maintaining in work in Bristol and South Gloss. I was also one of the 9 pilot sites for the project.
Very good. That's appropriate then. We should begin with Jack.
Thank you, Chair. Just like to welcome you all, particularly Joanna from Stoke-on-Trent as the MP for Stoke South. I know that you do some fantastic work, particularly with Saltbox in the areas. I want to ask particularly about the pilots that Nicola already mentioned and some of the things that have happened there, some of the improvements, the challenges that you faced with those pilots. So we start with Nicola.
The disappointment is that the final report hasn't been published, and it's a real shame that Sally's not here on the panel, the professor who led the Institute of Evaluation Studies. We understand the reasons for that, but yeah, I think Fiona will speak separately because neither of the pilots, but we were all doing very different things, and there was some really exciting stuff coming out about different ways of working, but it very much shows, and it picks up on the previous discussion, that there is no one fix that fixes all. And you do need to be flexible and look at different things. So, for example, in Northamptonshire, we'd been supporting carers for years. So we decided our bid was to focus on working with employers, because we've got mostly SMEs in a small and medium-sized enterprise is in Northamptonshire, a lot of logistics companies. And we decided we wanted to take the information into them to get them to think about, well, yeah, you have got carers in your organisation. What are you doing for them? How can you retain them? And we've built up a core using a lot of the information that Emily and Moira have been talking about getting them to look at their policies and approaching it in that way. And so we've now got, even though the pilot has ended and we don't have any funding for it and local authorities can't give us any money to do it, we are managing somehow to keep it going 1 day a week to carry on supporting employers. We've got a core group of 7 employers who act as peer support. We've developed our website where you can have carer-friendly employers who use our logo to say that they're carer-friendly employers, that helps them recruit other carers. So picking up on a lot of the stuff that you were talking about in the previous session.
I think the first thing I'd want to say is what a tremendous success the pilots were, actually, and thank you to government for funding those pilots, because they were very innovative, they were very informative, and I think the learning programme that has come out of that for the organisations, for the statutory partners as well, will be shown in the final report. The Dove Service worked with over 400 individual carers during the pilot, 26 large employers of 250 staff or more, and then 60 SMEs, and we ran 4 events on business parks. The key to that was partly through the Chambers of Commerce that we were a member of, and therefore were able to access a lot of different resources and networks to get to employers, because that was one of the key challenges. How do you get employers, managing directors, the senior staff to actually listen to you and to wake up to the fact that this is a growing and significant problem that will impact their workforce? So through those networks, despite it being a challenge, we were incredibly successful because we had the right people on board. And I'd also emphasise the role of DWP in that as well, in helping to open those doors and the partnership that we had together. The other side was actually the carers, and if I concentrate predominantly on carers that were currently in the workplace in those organisations, they didn't want to be identified. They were really felt at risk of discrimination. from colleagues and from managers, that people would feel, oh, well, they could have a lesser workload, for example, or that others would be covering for them. So there was a real fear of being identified. So there was very much an education process on both sides for employers and for the employee, that it was okay to kind of come out and share your story and be honest about your situation, because it would affect your long-term prospects. Because you would not potentially be able to stay in employment if you didn't have an understanding manager, employer, right the way up through the line. And then the final thing, I think, to say was one of the challenges was just the disjointed services that can be available, and I think most of the pilots experienced that. Very much a postcode lottery in terms of local statutory services, and lack of provision and lack of affordability of some of that provision as well. So if you've got a sufficient amount of income, yes, and whether you've got carer's allowance or not, it was a case of could you actually access the support, or was it there in the first place? And I'd like to come back to that point at some point, actually.
Fiona?
I think a bit like Nicola, we engaged quite a few local businesses and local carers. The kind of successes from Bristol South Gloss were the fact that we managed to engage with over 300 carers for information, advice and guidance, and give about 150 carers kind of more than just information, advice and guidance, kind of one-to-one support. Probably successes employers-wise for us was more about kind of DWP were a good success. We managed to kind of engage with them locally and do some things with them in terms of looking at local policies. Aviva were a local site who kind of formed their We Care pilot, which I'm sure I'll come on to later on, and Rolls-Royce as well were another one that were kind of deemed as a really good employer and started to do a lot of work with us. In total, we engaged with over 20 different employers. We did find that there wasn't really, I suppose, a requirement from the SME market. They didn't really want to engage with us. It was more the kind of larger employers, but then that did come with some struggles, because you found that although they would engage with you locally, they wanted something which was more of a national kind of fit, and we were only able to offer something on the local level. We did find that we've done some stuff with the local hospital trusts, and we've got some care strategies that are kind of going in there, but they've been a lot longer to kind of get anything moving with those. So it's been 2 years and they're still in kind of the implementation stages. I think probably one of the biggest challenges for us was when we did go to speak to businesses, we didn't have a named government sponsor for the project. So it was all kind of, we're doing this project and these are the 3 kind of bodies who are funding it. But there wasn't anybody with a name behind it to really push it forward, which was a real shame. And it's something that we did ask for within the project, which didn't seem to kind of come to fruition. I think legislation and lack of legislation meant that it's not a business priority for a lot of businesses. So, they had other demanding needs and Brexit and whatever else was going on. So it was always kind of pushed back to, something they would look at another day. I think lack of understanding and flexibility of working practices was also kind of key when we spoke to a lot of businesses. But obviously that's something we were trying to kind of help with. The ones we did engage with at a senior level, we did find that it kind of sat at the senior level and, they all bought into it, but operationally it never kind of hit the ground running. So I don't know if that's something maybe to be looked at. And I suppose it's more about kind of the people you meet as well. You may build kind of a great relationship with somebody, but unfortunately, people move on, and once you've lost that link, it was really difficult to kind of re-engage with people. And I think businesses as a whole, it was taking up to like 6 months just to kind of get your foot through the door to actually get a conversation with these people in the first place.
Great, Jack.
What things do you think need to be done to ensure that the good practice and the lessons learned can continue into the future?
Can I start? I think for me, obviously there were 9 pilots across the country. It's about postcode lottery again. So I think it's linking up with carers organisations, getting that message out there. It needs to be top down, I believe. It needs to be supported by the government. We were very disappointed that Workplace Charter is being monitored by environmental health officers. When we first met our Department of Health lead, they didn't know anything about it, and carers weren't put into the Workplace Charter. So it's missed opportunities, it's cross-government discussions. It needs to be top-down, it needs to be referred to. It also, I think it's about information and education. It's very labour-intensive, as Fiona has described. So you need people at the sort of coalface doing that, and we don't have funding to do that. You've got local authorities being hit. Fundraising is very difficult now, so it's about making that somebody's responsibility, I believe.
Joanna?
I think there's a range of things that really can be done. Just reiterating some of the work of the former colleagues. The carer passport system, I think, is quite integral to helping employers and carers to, again, navigate systems. And I don't really see why it is potentially not being rolled out right across the country rather than just big statutory organisations, and why it can't operate something like the Blue Badge scheme, is something that anybody has access to, providing you meet certain eligibility criteria. It should be easy to obtain, and therefore I'd suggest a full rollout of that for all relevant entitled carers. I think the carer leave entitlement is a very important option, but I appreciate the cost implications for that, particularly for small employers. And I think that does need to be considered and researched and examined in more detail. Access to assistive technologies. I think the whole technology market, as we all know, is opening up so many options, and therefore rolling out some of these schemes on a free basis, actually, for carers. Make life-changing differences. We had a small budget of £200 per carer for a pallet of just 20 people to roll out some assistive technologies, and some of that was adaptation aids. A lot of it was just apps and things like that on smartphones, but there was a subscription fee to pay, a monthly subscription fee. So to actually facilitate the cost of that made a big difference to some of those carers. So some very simple things like that. I do think there is the potential for legislative change here.
We're going to come on to those.
Okay, yeah, that's absolutely fine. Well, the other thing I do just want to refer to is because of this postcode lottery, I equate, and particularly for older carers, which was one of our specialisms where we were working, is, we have this system in the country where for parents returning to work, the nursery provision that we all expect, absolutely standardised, free care for 2, 3 and 4-year-olds now for a certain number of hours per week, is just embedded in the system. Why are we not employing such a system for people who want to be in the workplace, who are able to be in the workplace, and could have access to such a similar kind of care provision? Again, I realise the cost implications of this, but it's embedded for parents in work, returning to work. It's not for carers. And I think we need a systemic change and shift in our culture and our thinking to move that, particularly with our ageing population and the big problem that this is becoming.
Fiona, then Steve wants to come in.
I was going to say, I just think the evaluation, it seems like could get lost unless it's kind of shared with the right people. So I think it's really key that it goes to kind of businesses throughout the UK. I know that, what Nicola has said in terms of getting funding and kind of still being able to push this forward. It's really difficult to have somebody on the ground who's actually, working with businesses and kind of supporting them and supporting the carers, within the businesses. But I think without having that link or being funded to be able to kind of do that, it's something that unfortunately might just get lost.
Right. Steve? And then Emma.
Yeah, Joanne, I just wanted to ask, when you made the observation there about access to nursery provision, I mean, I can understand the moral argument you're making, but you said, I realise there would be cost implications. I just wondered if you'd given any thought to how something like that might be funded if a system like that were to be introduced.
I haven't given a lot of thought to be honest. It's a case of really just observations of how we operate in society and looking at cultural shifts that are potentially needed. I think it is more that there's just a huge gap there, and in some local authority areas there is still some daycare provision that exists and is statutory funded through social care. In other local authorities, a lot of the daycare provision has been closed down. When my father-in-law and mother-in-law, she was caring for him with early onset dementia at the age of 50, she was able to access great local daycare provision for a day a week to give her a carer's break, and it was all free. And we have nothing like that anymore these days. So many places have been closed down, and it's very much down to funding of local carer organisations and charities. Again, greater or lesser extent where something like that is available. So I think it's an immense challenge, actually, and something that's got to be looked at from a Treasury perspective.
We'll look at that in our report. Thank you very much. And now I want to move on, actually. Emma?
Okay.
All right, sorry, Jack. Yeah.
In terms of the variability that you've mentioned across the country, what do you think are the challenges in terms of rolling that out and rolling out these good practices to ensure that carers are supported properly? Because we do have, as you said, much is reliant upon charitable organisations who offer very different services in each of their areas. What are those challenges of rolling these sort of services out?
I mean, I think the core services are there potentially. I mean, I think whether it's Carers Trust, whether it's, you know, another voluntary sector organisation that's offering, I think there are carers organisations in most of the country, I think it's fair to say. So I think a lot of us are doing very similar things, so because there's a statutory responsibility to do things like carers assessments, looking at personal budgets, looking at direct payments and that sort of thing. So I think that infrastructure is there potentially, but it does need some funding, and I think certainly there is a funding issue.
Yeah. Joanne, quickly?
I'd just reiterate that.
Right.
Yeah.
Funding. Very good. Emma?
Thank you. My question is about potential changes to the law and national policy with your expertise and very clear frustrations in your work. So from what we've been hearing earlier, I wonder if you're thinking about, for example, accepting that people who provide care for people who need it, whether they're children or adults actually, are providing a service which is saving us money, saving the taxpayer money. So that's clearly not accepted, is it? I mean, it's normally seen as women's work, actually, to be honest, isn't it? Which is it is a problem. I've done it too, so we know what we're talking about. So this issue we were hearing earlier about normalising flexibility, that should be, maybe that could be in part of future national policy, whether it's for illness, childcare, or caring for adult social care. So normalising flexibility. I haven't heard about job sharing at all this morning yet, and I'm wondering, we're talking about cultural shift, but maybe we should have a statutory. These should be imposed. They should just be a good thing, which is good to have, which helps women look after whoever it is, because it's mostly women, unfortunately. But there should be statutory responsibility. So given those points that I've been picking up, what do you think for any change to legislation or national policy would be most helpful?
Shall we start with you, Fiona?
For me, it's more about, I think, kind of having a carers policy for most organisation that has some kind of A, flexibility, but B, kind of leave that's attached to it. We work with the local trusts near us and their recruitment policies to offer flexibility as bank work. Now, bank work is only flexible for the organisation. That's not flexible for the person who's working it, and they miss out on all different kind of rights as an employee and also kind of money. You can't pay a mortgage on bank work, but that's what they class as flexibility. So I do think there's a huge, kind of culture change that needs to happen as well, with kind of the way that organisations are kind of looking at their policies and the way they kind of put things forward. What I have found is, the stuff we've done with Aviva, we never had good before. What does good look like? And in my eyes, Aviva's policy is what good looks like, and it's having something that we can actually take out to other businesses and say, if this is what good looks like, this is what we're hoping you should get to. But yeah, I think at the moment it's difficult to know kind of what it should look like, because there hasn't been anything to compare it against currently.
Joanne?
In terms of job share, I think what most of us would recognise is that carers don't necessarily prefer job share. That might be relevant to a particular role and what have you. Actually, what they're looking for is part-time working and the flexibility. But bearing in mind what the previous panel was saying was, one person's flexibility is another's rigidity. You have to be very careful. One size doesn't fit all with this. So I think part-time working, I think the whole policy, employer policy side is very, very important. And it's great having hallmarks, best practice and what have you. But smaller employers just don't have the resource very often, or the the drive to put this into practice because they have other priorities. So I think it's thinking through how can we work, particularly with the SMEs. Larger companies are very good at this because they want to be seen to be leading edge and getting the kudos from that. But smaller companies are not, and I think that's where we really need to focus and think with chambers of commerce, with DWPs, with information education programmes for employers.
Nicola?
I don't necessarily think all the big companies are doing. I wouldn't agree on that, and I would also say that certainly in our county it's about 60-40 female, male.
Absolutely.
But male have different needs,
okay.
So you need a different approach. I would say, I was part of the parliamentary roundtable that reported to Alistair Burton and Ros Altman a couple of years ago, and we were talking about a lot of this. We were expecting a Care Act to come out. We were expecting new legislation. Unfortunately, it didn't happen. But I would bring you back to what's in this carer strategy. The goal of, as a carer, your well-being can have a huge impact. So it's about enabling those with caring responsibilities to fulfil their employment potential. It's written down, it's in the strategy. So let's put some teeth on it, I would say. Okay. But with regard to making these things happen, there's a lot of companies want to do it. Certainly the smaller companies that I've worked with, they want to do it, but they don't necessarily know how. And we mustn't chastise them to say they're not doing it. We need to give them the tools. We've developed the tools. There's a lot of expertise now from Carers UK and Employers for Carers, and now the 9 pilots. Let's get that report out there. Let's get the tips out to people to help them do it and offer them a bit of help to do it.
Before I bring Ruth in quickly, can you tell me, does every government department have a carers policy?
I don't think it does. I don't know, I'll admit, but I don't think it does.
And local authorities?
Well, I can only speak for our own, and they had to revise their policy. And what they did is they looked at it as part of this pilot work and simplified it. So it's technically there, but it's quite well hidden in all the
So look, we'll push with the government what they're doing through their big departments.
Yeah.
Would you give us the best examples in this with local authorities? So we can encourage other local authorities to follow. And what about the other big, the second biggest employer in my area is the NHS Trust. Have we got some good examples of trusts having carers policies?
We work with Northamptonshire Combined Healthcare Trust. They asked us to go in and actually review all of their HR policies and how they touched on carers, and that was quite a time-consuming exercise, but there are some good examples out there. They wanted to be part of the pilots. All of the statutory organisations within our footprint wanted to be part of the pilots.
Right. So we haven't got an example that you know of from a government, just one government department, and all of them.
The Government Ombudsman's Office has
Pardon?
introduced the Government Ombudsman's Office. Do we include that?
Yes,
they've got passports. They have been one of the first people, and they've shared information.
Can we have more information on that?
Yeah.
That would be brilliant.
Can I just say about the Health Foundation Trust in Northamptonshire, because they have been absolutely amazing. They've developed care ambassadors. We've gone in and done surgeries. They're running groups to support their own staff online and physically to meeting together. They have been absolutely amazing, and they have written it all into their services for their patients who are carers and also for their staff who are carers, and they are trying to prioritise. So if, say, a member of staff has an appointment to see the physio, they will try and prioritise that appointment because it gets them back into working and it supports them in their caring role. So they have been absolutely amazing.
It's just I feel that if the government actually put its own house in order, it would be a good example to the private sector.
Yes.
All right, Ruth and then Heidi.
Okay, thanks very much. In a previous committee sessions, we've been looking at the Taylor Review of Modern Working Practices, and obviously working practices and the changes in them impact particularly upon people with caring responsibilities. I wondered if you felt that some of those recommendations, particularly around employees having at least set hours of work with possibility of additional pay if they're asked to work extra hours, would be of particular assistance to carers who might incur extra costs if they're having to work extra hours.
I think it would be beneficial. I think, again, it's looking at small print with some of these things and making sure there aren't other conditions, etc., and just bearing in mind that need for flexibility, where that needs to be put in place. And that the carer isn't penalised. I think where someone is able and willing and has the care facilities care support there, then we should be doing as much as we can to help people, because ultimately work and good work helps people's well-being, health-wise, physically, mentally, emotionally. It's the right thing to do.
Heidi?
Just a quick question. Before we rush ahead and design our perfect piece of Care Act legislation, it just occurs to me, we've all touched on it a little bit, is this kind of a bit like caring for children as well, or just some other agenda in your life other than just work? Should any legislation we draw up just be about employment generally and flexibilities that an employer might have a duty to provide that would naturally encompass care workers, carers, or do you think we need something that's just about carers?
I think there's a lot of overlap. There was a company, I went along to a forum that Carers UK ran, and there was a company there that talked about space, and it was supporting parents and carers and everybody, because there is a strand of, we all need this time out, we all need some flexibility if issues go on in our lives. So I don't think it necessarily needs to be about carers, but carers need to be being talked about and being made aware, all being made aware of.
Does anyone disagree with that, either of you?
No, I kind of look at equality legislation and think that, we have specific categories that we have drawn out and said we need to protect. I think there can be general employment legislation, but likewise there are specific categories that we need to protect.
Right.
And carers would be one.
Yes, carers would be one.
And I think carers, more than anybody else, are the ones though who do take all their holiday in order to kind of care for somebody, and then they don't get a break. So it's kind of, that's why we need the extra kind of, I suppose, support for them in particular, because they're the ones who are doing the extra role.
Can I just say though, you don't choose to be a carer. You can choose to be a parent. It can happen. Somebody can have an accident now, and they go home and they're a carer.
Mm. Yeah, that's important to that adjustment period, isn't it? Emma?
Do you think, do you agree that as we head towards hopefully some really good, robust changes in legislation and national policy, do you think that the next stage is to highlight the benefits to everybody, including us, the taxpayer and so on, of good practice in particular organisations and businesses? Do you think that's a good way forward? Yeah. Okay, that's... Yeah.
Have you got examples of organisations who think that they're financially better off because they've actually behaved well for... I see our next panel's nodding. but if you've got examples of that in answer to Emma's question, could you give it to us? Because it'd be really helpful in our report.
I haven't, but I don't know whether...
No, there's people coming late. We've got another panel, so... But
we would be able to give a couple of examples. Finning UK and Jaguar Land Rover were two.
Fiona, Emma's question? Have you got examples of employers who believe they're financially better off by providing the sort of programmes that we've been talking about this morning?
Probably not specifically, but we probably could find some.
Could you
do we've been
that?
working with Aviva.
Really strengthen our report.
Yeah, that's fine.
Then Chris?
Thank you. The widespread consensus and all the evidence we've had so far is about a requirement for a cultural shift. Obviously, people who don't identify as carers, or even when they do, don't feel confident to raise issues. On the other side of the coin, employers think they're almost given a favour if they talk about flexible working. So what can the Department of Work and Pensions do to promote a cultural shift towards helping carers in the workplace?
For the stuff we've done with DWP, it's more about kind of giving them training, again about who carers are and understanding their needs. I know locally within our kind of DWP kind of agencies that there's people out there who do kind of business as well and go out and kind of look for business. So it's more about finding businesses or kind of, I suppose, vacancies that are flexible to people. So we're actually lining people up with kind of the right kind of work. There's nothing worse than somebody going into the job centre and being told that there's a full-time job that they need to take when actually that's, they could never do it. They're already caring for somebody. They already have a job, but they're just not getting paid for it. So I think it's more of a better understanding of what it's like to be a carer. But I do think until you actually end up in that situation yourself, you don't tend to kind of understand it.
Joanne?
I think, again, DWP, some of the training that they offer, again, encompassing carers, is very, very helpful, both for employers and for carers. But I think that if they, at a local level, can identify local companies who are carer-friendly and build a toolkit around those organisations, it will start to influence other organisations through their networks and what have you to improve practice and to move things forward. So it's kind of coming from grassroots up, really.
We've worked considerably with the DWP in our area, but it's slow work, and there's a lot of DWP offices. We're actually doing a marketplace event in one of the job centres next week, and we've actually done joint training with the DWP, and we've asked them if they can mail out information to carers that are on certain benefits or people that are on certain benefits. They find that difficult, so if that barrier could be removed. But also we've spoken to disablement advisors, I think that's the phrase that they use, and about, because if there's somebody that's perhaps got some health issues, there might well be a carer lurking in the background as well. So it's about just getting those discussions going, I think.
I think also as well, just because you're a carer doesn't mean that you automatically want to become a care worker, which seems to be something that they automatically kind of send somebody on that route. So kind of being aware of the other roles and transferable skills that carers have that they can utilise in different professions.
Well, it's also a sector of the economy which is precarious in terms of its work, in terms of some of the evidence we've heard and other matters. So do you think that we're looking at training for the job centres then, in terms of trying to steer people away from sectors of the economy which are known for being precarious work, but where there are late notice shift changes or cancellations and things like that?
What I would like to see is a checklist where actually when they're working with individuals, they go through certain issues and they ask those questions: are you a carer? And then they refer them to somebody if they want
is that
to.
for job coaches? Are they the
It doesn't
key
have
people?
to be. It can be, but I think anyone who comes into contact at the job centre, at any route where there is one-to-one time, you can ask those questions.
Which is why a carer's passport would be ideal.
Yeah. No, that's really good. You want to come in?
Yeah, I just wondered, I was thinking about Emma's question earlier about job sharing, and I just wondered, you've all been involved in pilots. Would there be any merit in actually having a pilot to incentivise employers to package certain jobs as job share for carers? Presumably this would get round the problem of some people needing time off because it could be managed. Would there be any merit in that specific approach that says we're going to incentivise these employers, we want you to identify jobs that could be for carers and they should be job share jobs so that we resolve this issue of people needing time off?
I think pilots are always a good idea because it, again, the learning and information, the research that comes out of them can be so extensive, and I think something like that might be worth exploring. Alongside that, I wonder whether tax incentives for employers to actually, whether there's a reduced national insurance threshold for them specifically for that, will draw them in and help to make a success of these things if there's a financial incentive as well.
I've worked on a job share basis, and I think actually I felt more restricted doing that than I did working part-time, and I actually made the choice to go part-time because I was a carer for my mother in a very heavy caring role. The lady who I worked with very closely at work, we were both in heavy caring roles and caring situations at the same time, so it wouldn't have actually saved anything with us. So I think you just need to think through, it can be quite restrictive.
Okay, thank you. Really good. Thank you very, very much. And we look forward to that additional information. We'll kick off with these others sitting up their chests with exactly
I've got a constituent friend.
That's what the case is.
No, I'm so proud of the fact that my team actually got that choice.
Really good, thank you very much. Lawrence, as you're not pouring water, might you begin the introductions?
My name's Lawrence Beckett. I'm the HR Director for the Savings and Retirement business for Aviva UK. We employ about 16,000 people in the UK across 22 different locations.
Brilliant. Arthur?
I'm Arthur Allen. 30 years ago I founded this, what was then a very tiny business called Listerwood. This business has now grown to about 120 people here in the UK, in King's Lynn, where we manufacture and decorate promotional products. We have a factory in India with about the same number of employees. We have a long-standing reputation for flexible working and family-friendly practices.
Very good. Chris?
Thank you. Mr. Allen, from an employer's perspective, what are the barriers to employing carers, do you think?
We found this quite a difficult question. Let me talk first of all about the perceived difficulties. I think there are perceived difficulties. All employers would like everybody to be able to do everything whenever they needed it, and that's of course a pipe dream. And there is a fear that if somebody has caring responsibilities, they won't be available when they are needed. There are also anxieties that they may be distracted by very serious caring responsibilities elsewhere, and that they may become unreliable. I said that these difficulties, I think, are perceived difficulties, and I mean that because I think the difficulties are actually much less real if the situation is properly managed than many people think that they are.
Lawrence?
Yeah, so I think what we would consider is the opportunity for retaining our carers, and that's really been the focus of our work. Has been much more about how we make it clear to carers in our workforce that they are welcome and that we want them to feel that they can fulfil their caring responsibilities whilst also remaining in employment with us. So we've tried to turn it around and look at it as an opportunity to promote the caring policies that we introduced last year.
So perhaps Mr. Allen first, in terms of flexible working, at the moment it's a right, it's a request. Do you think it should just be a right?
We wouldn't have any problem with it being a right. It's already well established within our organisation. Right from day one, when people join the organisation, they mostly know that they're joining an organisation that's got these sorts of policies and practices. It's reinforced at induction, and it's reinforced in the canteen chatter, and it's reinforced when they themselves need that flexibility.
So the view, the values goes right through the company?
It does indeed, yes.
Mr. Beckett, should it be a right?
So we, as part of our standard job advertising, all of our job adverts include the opportunity to request flexible working. So we make that very clear on all of our job adverts. That doesn't necessarily mean every job can be done part-time, but working from home and looking at if you've got a requirement to work flexibly, we want to attract the best candidates. So if you've got a requirement to work flexibly, we want you to apply and talk to us about what that requirement is, and we will try our best to meet it.
So what kind of jobs would you or your organisation be a bit more cautious or find it far more difficult perhaps, given that flexibility? What sorts of jobs?
So, for example, for our frontline customer operations, it can be difficult for them to work from home, so that's a challenge. But we are open 8 till 8 for our customers, so we have a range of shift patterns that we can offer. So if doing a 12-8 shift works better for you, so you can do some caring duties in the morning, we can accommodate that, or if working early and finishing early works better.
And as a large organisation with people doing similar kinds of roles, it gives you that flexibility because you have a very significant workforce. What concerns would you have if you didn't have the same approach as Mr. Allen's company? What challenges do you think there would be for a smaller company without this kind of scale?
I probably wouldn't presume to. I've worked for Aviva for 28 years, so my experience is largely big company experience. So I wouldn't presume to know the challenges of a smaller business.
If I could say something here, I don't buy this argument about small companies or big companies. I've met lots of people who work for big companies who try and tell me flexibility is very easy if you're a small company. Yeah, and I've met lots of people in small companies who tell me, "Oh, flexibility is very easy if you're a big company. You've got all these resources."
Yes.
There's no doubt whatsoever that the way in which we support carers and the flexible policies that we have will differ in detail from what Aviva do. We're 120 people in our organisation in King's Lynn. Yep. So the detail will be different, but what I think will be absolutely identical is an underlying organisational culture. And if that organisational culture is based on mutual trust and respect, all of the details can be sorted out pretty easily. That's the bit that's absolutely critical.
So there is evidence saying that about 20% of jobs paying under £20,000 per year are advertised with part-time or flexible working as an option, and only 10% of jobs paying over £20,000 a year have that same flexibility. So there's an indication it's fairly limited. It's not an option widely available, and it's far more restricted as you go up the pay scale. Is that
so interesting? So the reason we changed our approach to our recruitment adverts last year, so we used to have flexible working wording as an option. So the default was full-time employment, and 99% of our job adverts went out as full-time opportunities because that was the default, and managers had to proactively request this is okay for flexible working. And as part of our looking into this whole area, we said, why don't we just flick it and say flexible working is standard, that is the way the world is going. We did it for a 3-month pilot, and we had one manager complain in that 3 months that it was going to be difficult for them, and so we just implemented it as a...
difficult for the team that manager has.
And there is work to do with line managers around understanding exactly what we mean when we say flexible working.
So, Lawrence, what was the factor that made your company flip in that dramatic way? What event?
I think it was just we're trying to modernise our employment practices, and we had taken a lot of... as part of the Fuller Working Life strategy, we did an over 50s survey in our organisation and asked people what it was like to work for Aviva if you're over 50. And the biggest single thing that came out was the need for flexible working. That was the top issue that got mentioned the most time. So we were just thinking, how do we respond to this, and what are the things that we can do to make it better for that particular population? Not in isolation, but...
Thank you. So it's, there's always that concern whether something's a net cost, a net benefit to a company, but in this sense, both of you, the evidence you're both giving is in terms of having that flexibility, that supporting environment for carers. It's a net benefit for your organisations. Do you think this is widely known? If you take the right approach, have the right attitudes, that this is widely known enough, actually this will improve your business?
So the pilot we did in Bristol, where we did a big launch around revamping our carers approach. One of the we had a carers policy before, but it wasn't well known and it wasn't well utilised. There's now an 80% awareness in Bristol of the approach.
I think we're going on a little bit more later on into the Bristol example, but
so awareness in general is definitely an issue.
Yep. So just take it on to next question. Perhaps not going into too much detail about Bristol, but can you describe your approach to employing carers and the impact this has on the business, and perhaps especially with employees? Go into a bit more detail on that.
Sure. So probably the place to start is, we relaunched our carers policy in October.
Yeah.
So we've introduced 5 days paid leave for planned appointments and 5 days paid leave for unplanned care issues. We also did some independent research, and 83% of carers said they wanted an equal footing with parental leave, so the right to 18 weeks unpaid leave for care responsibilities. So we've introduced that as part of our policy as well. Our belief is that where we employ someone, if they have a caring need outside of work, it is likely going to be the most important thing in their life for that period of time. We've trained and developed those individuals, and we do not want to lose them from our workforce. So we believe there's a substantial benefit in working with our employees to try and find ways to retain them while they have that caring responsibility.
I'd endorse that entirely. It has benefits in terms of employee retention. It has huge benefits in terms of the commitment that employees give back to you. If you support your employees, the employees will be taking care of your customers. Yeah, there's absolutely no doubt about that. But in terms of, we touched on the issue of what is the financial benefit to companies, and we would see that benefit as being absolutely huge and vital. In 2008, when the credit crunch happened, we lost 25% of our business, more or less, overnight. Our main products were producing mouse mats at that time. The mouse mat market has is very, very much. We've had to replace about 60% of our business with alternative products. We've had very difficult years in the last 8 or 9 years. We would not have got through this without the support of our staff, and we've asked them to do very difficult things at times, and they have risen to the challenge without any difficulty or hesitation at all. They wouldn't have done that if we hadn't have supported them when they needed it. So we're very clear on the benefits to be gained from this.
I think you're both expressing views which are consistent with our best asset are our people in terms of companies. And you take the approach as you do. Now, some people would argue that the higher employment is, the more power shifts from the employer to the employee. We're not always going to be in the position we are at the moment with relatively high employment. So should these practices that you engage with, should there be more government legislation to direct companies? I'll give Mr. Becker first.
So Andy Briggs, the CEO of our UK insurance business, in his role as the government's business champion for older workers, has recommended that 5 to 10 days carers leave should be statutory.
Thank you. And we heard that on the previous panel as well.
Yeah. And in practice, we are doing that with many of our employees who suddenly find that they need time off. Your earliest witnesses talked about the dreadful chaos that carers are suddenly plunged into on occasions, yes. When grandmother falls over or whatever, and many employees, their first thought is, I have to give up work, and our first effort is to say to them, no, calm down, take some time, go and concentrate on dealing with the caring situation. We'll be here for you when you need it. That's absolutely vital. And we're supporting that in many cases with paid compassionate leave or paid emergency leave. We wouldn't have a problem with that. I'm aware that not all employers would necessarily take that point of view, but that would be our point of view.
Thank you.
Right. Quick one from Emma and then Alex.
Yes, thank you. Do you think, while we're working towards stronger national policy legislation, to incentivise good practice, do you think, as we were hearing earlier, that tax breaks should be offered to good employers, or do you think that the reputational advantage that we've been hearing about, that clearly your businesses have attracted, do you think that the fact that it attracts staff loyalty that you just talked about, do you think that's a good enough incentive rather than a tax break?
Well, it has been for us.
Good.
But I appreciate that not everybody takes the same view.
I would concur.
Yeah, I'll concur.
Yeah.
We're looking out for the best interests of Aviva customers. We know that treating our employees well is the best way to do that. So we don't believe companies need to wait for legislation or should wait for legislation, but there are wider issues for government to consider than, so from an employment perspective, we think we're doing the right thing for our employees and our customers.
Heidi wants to quickly come in before we go to Alex. No?
Really speedily, just I'm smiling so much because I run a small business that my husband now runs, and he would love to talk to you after, because this stuff works. Can I just check then, in both your opinions, you talked about culture a lot, we heard that in previous evidence session as well, that actually a tool like a tax break is almost wasted. You're either culturally ingrained to treat your employees in this way and you want to do it, or you're not, and that stick actually wouldn't achieve anything. Am I right in thinking that, or?
We wouldn't say no to a tax break.
Sorry, stupid small business.
The treasury was called that dead weight.
Would it be the perfect answer, I suppose? Would it just magically make things improve in businesses?
I think you're probably asking the wrong people.
Yeah.
Yes.
All right.
Okay.
Very good. Alex and then Steve.
Thanks, Frank. And you both obviously have a lot of experience of various policies and pilots that you've seen over the years. Which ones would you like to see rolled out more widely and why?
So the pilot we did in Bristol, there were three things that made the real difference for our employees. So the first was raising awareness and changing the policy. That made a significant difference. The support that was provided by Bristol Care Centre that Fiona talked about earlier, our employees who were plunged into that care need, who could access one-to-one support to help them through the system, found that immensely beneficial.
And we joined the Employers for Carers website, and the ability to access the right information online at the point of need has been fantastic. We tried some other things that did not work so well, but they were the three things that really stood out.
Just quickly.
So we
you thought had
provided
potential
access to some webinars that were, and it turned out that in our experience they were either too high level or too lengthy, not specific enough. And so our employees who are carers, who are already pushed for time to do work and caring, didn't find that useful. So we pulled the plug on that aspect of the pilot.
Excellent.
Martin?
I mean, what we're doing within our company seems to work fairly well for us. It seems to work fairly well for our employees. I'm sure we can do some things better. But I think the thing that we would really like to be better is for those employees who suddenly find themselves plunged into this nightmarish world, is that it should be as easy as possible for them to find their way through the care system and to understand what help is available and how they access it and to get that help. And I think that's really important, because we have reports from our staff that that's actually at times very, very difficult.
What would be the shape of that, Arthur? That point of contact which would help. You're giving flexibility, but there's employees who are now carers as well as employees, concerned about what other support there may be. Where should they look for that?
Well, I think one of the
stop shop
places that people can look, but I think it's a service that's got much greater demand on it than they can cope with, which is the helpline that Carers UK run, for example. I think that's a good example of something that's very helpful. And just speaking about Carers UK, you asked a number of questions about examples of good practice in government departments, in local authorities, and in businesses. Carers Information have Carers UK have chapter and verse on that. And
Very
they can
good,
certainly
thank
help you
you.
with that.
The other thing that we do, we provide our employees with an employee assistance program, which is a phone line that they can call for any needs that they have, counselling, bereavement counselling, whatever. One of the services they provide is if you're put in a caring situation, they will help you, but it's a phone service rather than face-to-face. And in our Bristol pilot, we did find that the face-to-face, someone coming and sitting with you to help you do it, was much more appreciated. But the phone service is better than nothing, for sure.
Thanks very much.
Steve?
Yes, I just want to return to this issue of flexible working. And I just really wondered, do you think it should be available as of right from day one for carers, as is the case for employees with a disability?
Okay. Well, our experience is that we don't have an issue about the time scale, about whether it's on day one or whatever, or whether people are coming to us at job interview and talking about our caring responsibility. We're not concerned about a time scale. We don't have any time scales like that. What's happening with us is that when we're dealing with a carer, or a carer comes to us and there's clearly a problem, is we want to sit down and negotiate a win-win solution. We don't say yes to every request for this to work, to have Friday afternoons off, or to have Monday mornings off, or anything like that. We don't say yes. The flexibility has to be a two-way street. It has to be good has to work for the employer, it has to work for the employee, and you have to work hard to find that solution. And again, if you have an organisation where there is openness and there's trust, that's not too difficult to actually achieve. But it's not an automatic right that an employee can come and say, I want this element of flexibility, and they automatically get it. We have to look after our customers too. But I asked my HR manager, who's just behind me this morning, if we could think of a single instance over the last couple of years where we lost an employee because we couldn't find a suitable way forward, with that employee. And the answer was no. We couldn't think of a single instance where we couldn't get a working solution.
Lawrence, given that you've now, in a sense, packaged all your jobs with the flexibility rather than the sort of the time factor, how has that changed in answer to Steve's question? The people coming forward from day one saying, I've got caring responsibilities, feeling they can talk to you about it?
I haven't got precise examples around that, I'm afraid. I can look into that and see if I can come back with something.
Could you? Yeah.
Can I just check? I'm just thinking about what Arthur said there. I mean, it seems to me that the current situation, it's all right if you have an employer who's already got a fairly open-minded approach, but the current situation is that you have to wait 26 weeks before you have an entitlement. Now, I hear very clearly what you were saying about the actual nature of the flexible working needs to be subject to some kind of rational negotiation process. That strikes me as sensible. But what I'm really asking is, should there be a presumption that the person has an entitlement to flexible working? It may then be down to a question of how that is negotiated. Well, I don't understand the distinction. I guess the point I'm making is, if I've got a disability and I start work and I have an automatic entitlement, and I've got a caring responsibility and I start work, why don't I have the same entitlement? I'm not quite clear what that distinction is, and I wondered if, in your experience, you could explain that.
I think we did a staff survey recently, and we had 100% of the staff said that if they required time off at short notice or no notice, 100% of the staff said they knew that would happen. 98% of the staff said that any request for flexible working would be considered fairly, yeah. So that's undoubtedly the case. But if you come and say, I have a requirement to have Friday afternoons off, yeah, that's not necessarily going to be exceeded unless we can manage it. If we can manage it, fine.
Yes, I understand.
Yeah.
Lawrence?
Yeah, I almost refer back to previous. I think you're possibly asking the wrong people, because we're kind of intuitively already in that space where we wouldn't consider the time frame to be an issue. So I think it...
Can I then ask, if you're in that space we'd like many others to be, how many employers come and ask you how your systems work on this policy to carers? Lawrence? Are they banging at the door regularly saying, can we come and talk?
No. We have presented at employers for carers sessions and kind of tried to publicise what we do, but I guess our primary focus is succeeding in our own business.
Arthur?
I have an identical answer. We presented at employers for carers, and they've done great things, I think, in raising this issue amongst carers.
On that note,
amongst employers. Sorry,
employers. On that note, we'll end. Thank you very, very much. It's been a great session. Thank you.
Thank you.
All three of them have been.